Emilia-Romagna region for the screening tool to avoid unnecessary hospitalization.
So the idea was, I think you can go to the other one. The idea was to have an approach in order to stratify the population of the Emilia-Romagna region by risk of hospitalization for preventable condition. So the idea was to take advantage of the data we have in order to identify those citizens who have risk factor to being admitted to the hospital in the following years for example, ambulatory sensitive condition. And the model has been developed, is quite robust, has been published, and it has been integrated in the day-by-day work of the community health center in order to provide the team with data that can be used in order to identify if there are changes that need to be done. So the model has been developed in this way. The next slide. These are the information who are used to build up the risk score. That means chronic disease, multimorbidity, drugs, specialist visit, hospitalization, emergency care, and adherence to guidelines. And for example, this is how the Emilia-Romagna region is stratified based on data on 2015 for their risk in the following year, and nearly 6% of the population is classified as at very high risk or at high risk. And if you look at the distribution by age or by number of chronic condition, is of course those who are elderly and who have a great number of chronic condition are more frequently classified as at very high risk or at high risk. The next one. This is for the identification. Then these data are used to take in charge. So they are sent back to individual community health center, not to the GP only, but to the team, asking them to work together for each individual patient in order to see if there are things that can be done better. For example, this is a snapshot of the report, individual report, which is fed back. And for that, the previous one, for each individual, they know which are the chronic conditions, if it has been hospitalized and for which causes, if there were emergency room visit, the next one, if they were specialistic visits, if what was the drugs, what were the drugs that patient was taking. And all this information, the next one, are used, as I told, to activate an individual plan to see if something can be done more. And this is also a way to promote a new way of working in this community health center, because people are forced to work together with a specific aim, but they need to work together. And also is important because it's the first step to identify not only health problems, but also social problems. We tried in the next one to evaluate if it's working or not. The data are quite preliminary. And since now 11 community health centers have been involved in the exercise to use this data to understand if something can be done better. And we also try to collect the point of view of beneficiaries, patient, and professional. And I will just briefly show you what is the results for one community health center, the next one. in which, for example, they were fed back these numbers of patients at high risk or at very high risk. You can say that also for the very high risk, those that in theory are the ones that we expect to be taken in charge, the team decided that only 0.5% were okay. No action was needed. For the other half, they recognized that there were unmet needs, social needs, treatment to be revised, that the patient was not compliant to therapy, that he needs integrated care, and they decided to put it in a pathway in order to take care of him. And this was for the very high-risk patient. If you look at the high risk, the situation is even worse. So there was a lot to be done. And from the preliminary perception from patient and healthcare professional, this tool seems to be very useful in order to promote integrated care. So next, the video to look at results. That's it. Thank you.